Hi, this is Anu and you're watching Anaphonesis. Today we shall review one important topic from endocrine system which has got significance from your exam point of view. Cushing's disease. You must have heard about Cushing's disease and Cushing syndrome. Is there any difference between these two? Yes. Cushing disease is when there is too much of ACTH comes from the pituitary, and Cushing syndrome is when the body makes too much cortisol irrespective of the cause. Mainly it can be drug induced. You know that many cortisol drugs or steroid drugs patients are getting for some the treatment of asthma, arthritis and all. These patients develops Cushing's, and this is Cushing syndrome. That's the main difference between Cushing's disease and Cushing syndrome. Before going into the detail of the disease condition, we shall review cortisol. So the hypothalamus, that's producing CRH, that's a corticotropin releasing hormone, stimulating the anterior pituitary to release ACTH, adrenocorticotropic hormone, which stimulate your adrenal glands to produce this cortisol. And you remember adrenal gland has got adrenal cortex and medulla, and again in the adrenal cortex there are three layers. That's a zona glomerulosa, zona fasciculata and zona reticularis. Remember the acronym GFR. And the zona fasciculata is responsible for the release of or the secretion of cortisol. You can also call it as stress hormone. The functions of cortisol include, in stress, it has the function of gluconeogenesis, lipolysis and proteolysis. It produces new glucose molecules and break down lipids and proteins. It has also got a role in mood and memory of the person. It acts as a part of circadian rhythm. That means in the morning cortisol level peaks and it giving you a wake up alarm. Get up, go. And again maintains BP. How does it maintain BP? It actually increases the sensitivity of the peripheral vessels to catecholamine, and also it causes narrowing of blood vessel. Thus it helps to maintain the BP. And again, you know, it has got the property of anti-inflammatory, and also it has got immunosuppression, so that it decreases the immune response and inflammation. These are the very important functions of cortisol, and we shall review Cushing's disease now. What are the reasons for Cushing's? Mainly it can be external or internal. External, the major factor is steroid therapy for asthma or arthritis, and the internal cause can be either pituitary tumor or adrenal tumor or the ectopic site, that's mainly lungs. Small cell lung carcinoma is one of the major ectopic site that causes Cushing's disease. How will you diagnose this? The major test what we are doing is the 24 hours urine free cortisol test or dexamethasone suppression test, that's done overnight. There is low dose and high dose of dexamethasone suppression test based on the tumor site and all, but you just have to remember the term dexamethasone suppression test. What are the features of this Cushing's disease? And you know, whenever you remember about Cushing's disease, the first point come to your mind is the moon phase. Yes, there will be a moon phase, and also truncal obesity and thin extremities. See, the trunk will be obese but extremities are thin with supraclavicular fat pads. Buffalo hump and moon phase. Then striae, there will be stretch marks, especially over the abdomen. Then osteoporosis and even kyphosis can develop in some patients. Mood changes that can even lead to depression because of the immunocompromise. It can lead to infections, and it affects the menstrual cycle of females. That's mainly it inhibits the gonadotropin releasing hormones, and thereby it affects the reproductive function, and it also causes easy bruising and poor wound healing. So these are the important features of Cushing's disease. Now regarding the mineral disturbance and all. From this area, a lot of questions comes, and always remember it causes hypernatremia and hypokalemia. The thing is, cortisol in high concentration can show some mineralocorticoid activity, and we already have learned that mineral corticoid, the major function is sodium water retention and potassium excretion. So when there is too much of this, what happens? Sodium and water will be retained, causing hypernatremia, and potassium loss, causing hypokalemia. That's one important thing to remember. So increased sodium, increased BP, this definitely will lead to edema. And no, cortisol will increase your blood sugar level, and the important feature to remember is hirsutism, that's increased hair, and it reduces calcium and potassium, and in addition these will be increased. Ulta of this will happen. Management. How will you manage this? It depends on the cause. So what's the reason? If it is drug, what is it causing? That you are taking treatment for arthritis or asthma, you shouldn't be stopping it soon, because it can cause adrenal crisis. Instead, you can taper and stop the drug. Or if it is the tumor, then you have to treat the tumor. That's the management. And once, if there is, like after the surgery or treatment, if there is deficiency of the hormone, lifetime hormone replacement has to be done. Now let me ask you one question. What is the common cause of Cushing's disease? Whether it's iatrogenic, pituitary adenoma, adrenal tumor, or small cell lung cancer. Yes, it is iatrogenic or drug induced. Iatrogenic means the meaning is physician induced or a procedure induced or a treatment induced. So it can be iatrogenic due to the treatment for arthritis or asthma drug. That's the main reason for this. With that, we are winding up for today. And again, we'll be back with another interesting topic. Please study properly, and we will see again. Till then, bye.